VISITECT CD4 Advanced Disease is the only instrument-free rapid test on the market that supports the identification of advanced disease in people living with HIV. How to perform the VISITECT CD4 Advanced Disease test. Materials provided to run the test are the test device, a sampling device, a bottle of buffer, an alcohol swab, and retractable lancet. Instructions for use and job aids are provided in each kit box. You will also need disposable gloves, a timer, a pen, a sharp spin, and dry gauze or tissue. For EDTA blood sampling, you will need an EDTA blood collection tube, a precision pipette, and disposable tips. Always refer to the instructions for use for the most up-to-date version of the test procedure. Allow the test device and components to come to an operating temperature of between 15 and 35 degrees Celsius before use. Do not open the foil pouch until you are ready to perform the test. Once you are ready to perform the test, check the foil pouch for any damage. Check the expiry date on foil pouch and kit components are within date. Tear open the foil pouch and remove materials. Ensure a desiccant is present and discard. If no desiccant is present, discard test device and use another test device. Disposable packaging in a general waste bin. Write a patient identifier on the test device. Put on a new pair of disposable gloves. There are two types of blood samples, capillary and venous, EDTA. We will cover capillary first. Ask the patient which is their non-dominant hand. Clean the side of the finger with the alcohol swab where the prick will be performed. Allow the finger to air dry. Twist off the lancet cap and pierce the skin of the fingertip to the side of the ball of the finger. Dispose of the retractable lancet into a sharp spin immediately. Wipe away the first drop of blood with a piece of dry gauze or tissue and dispose of in the sharp spin. Gently squeeze the finger until a full drop of blood develops. Hold sampling device horizontally and touch the tip of the sampling device to the blood sample. Capillary action will draw blood to the black line, which is 30 microliters. Do not squeeze the bulb to draw blood into the tube. Use the sample immediately. We will now cover venous EDTA blood sampling. Collect a venous sample of blood using established techniques. Prepare the precision pipette volume to 30 microliters and attach a disposable tip. Mix the EDTA blood sample by gentle inversion at least 8 times and ensure fully mixed. Open the EDTA blood tube. Press the plunger button of the pipette to the first stop. Immerse the disposable tip vertically into the EDTA tube. Smoothly release plunger button, drawing the blood into the disposable tip. Whichever sample you use, capillary or venous, the rest of the test process is the same. Touch the center of well A lightly and squeeze the bulb of the sampling device or depress the pipette plunger gently to ensure the full 30 microliter sample is released into well A. Discard the sampling device or disposable tip into a sharp spin. Wait for 3 minutes. After 3 minutes have passed, add 1 drop of buffer to well A. Hold the buffer bottle at a 90-degree angle, perpendicular to the test device, 1 centimeter above well A. Do not squeeze the buffer bottle too hard. Wait for 17 minutes. After 17 minutes have passed, add 3 drops of buffer to well B. Hold the buffer bottle at a 90-degree angle, perpendicular to the test device, 1 centimeter above well B. Do not squeeze the buffer bottle too hard. Wait 20 minutes. After the test is complete, interpret the results within 5 minutes. It is extremely important to know how to correctly interpret the test. To determine the test is valid, both the control C line and reference 200 line must be present when reading the test results. Results are interpreted visually by comparing the color intensity of the test T line with the reference 200 line. If the test T line is the same color intensity as the reference 200 line, the CD4 count is estimated to be equal to or below 200 CD4 T cells per microliter. The test is interpreted as below reference. If the test T line is lighter than the reference 200 line, the CD4 count is estimated to be less than 200 CD4 T cells per microliter. The test is interpreted as below reference. Note that if the test T-line is very light or missing, the CD4 count is estimated to be below 200 CD4 T cells per microliter, and the result is interpreted as below reference. If the test T-line is darker in intensity than the reference 200 line, the CD4 count is estimated to be greater than 200 CD4 T cells per microliter. The test is interpreted as above reference. If the reference 200 line is missing, the test result is invalid. Repeat the test. If the control C line is missing, the test result is invalid. Repeat the test. Once you have finished interpreting the test device, dispose of the device and gloves in the sharps bin. VISITECT CD4 Advanced Disease Test, supporting the identification of advanced disease in people living with HIV. Visit our website today, www.omegadiagnostics.com. Send us an email, odl@omegadiagnostics.co.uk, or get in touch on social media for more information.